you are, or what did I say? But I mean, you also see that you will also see that maybe somewhere along the line you are also aiming high. But my dear men, I'm not going to worry about it. This is psychiatric that we are doing, so we are allowed to counsel alongside. You see, when you go out there, the researches that we are having suggest that it's not necessarily size that satisfy women. Those women that you are hearing shouting and then praising sizes, they are mostly prostitutes or people who have had several encounters with different men. Okay, they have multiple sexual partners. That's why they are able to decipher between which one is this and which one is that. And some of them will even tell you, say, it's not even about how heavy, but how you use it. They tell it. But in a study that I quite remember, what made women really enjoyed intercourse or intimacy was a connection or the affection for the man. Mm. That one scored high. Yes, it was not necessarily about the size. There's a difference between how social media present things and how if you find a scientific method of inquiry, you also get. Okay. And then the women, I'm telling you, most of the men, see, when it comes to pleasure, they may want some things around some women, but when it comes to settling down with a woman, they will likely settle with somebody who reasons well, who they connect well, who respects them, who, depending on the culture where they find themselves. So please look, look beyond some of these things, because it's not what people normally say that is it. What you are saying or you are seeing is called anecdotal evidence. You see, say, oh, Krum Hadias will be a kasafa home. Everybody is talking about this that way. Try to conduct a scientific research with the proper approach, and you see that no, it's quite different from what people just say. When they are isolated and they are given the chance to really talk about it in its reality, it's quite different. So, my dear sister, my dear brother, do not harm yourself. If she or he doesn't like you, there will always be somebody who genuinely likes you. Okay. Yeah. Another classical feature of psychotic symptoms is hallucinations. And we have different forms, and they are quite classified according to the senses we have in human sense data, like auditory, visual, tactile, gustatory, and olfactory. The meanings are there. Auditory has got to do with hearing. Visual, seeing, sight; tactile, touching it; gustatory or gustatory, it's amount, it's with taste, your tongue. I feel like no, this is quite different from somebody eating and having an effect. Like their condition, somebody can have COVID-19 and not really feeling having a taste. Don't say the person is hallucinating. No, don't be just don't go in that hasty conclusions. You it could be something else. But people without eating can even tell you, say, I hear the papa hair. Sophia Midi, like eating something which does not even exist, but the person is actually feeling it on the tongue. Okay. Sometimes too, people smell things that are not existing, but there are some smells they are real because you, the person having the honam kankan or body odor, sometimes like Maud will tell you, the scent has been with you for a while, so you have modernized. Your nose have been tuned to magnifying smelling 78.2. So you are not hearing your you see, you are not hearing. You are not smelling yourself. Or sometimes when you add a perfume to yourself, you bought a very expensive perfume. You feel like this perfume, they've written all the perfume, meaning it should last long. The guys who are into buying perfumes, they owe the toilet also, they have very sweet opening, but mostly they do not last long. But the older perfume, they have strong openings most of the time, and then they last longer. So if you want what lasts longer, these are the notes you should be looking for. And then you add whatever you want, whether oceanic, fruity, or whatever. Huh. But when you take all the perfume, for example, and you spray a couple of times, you open it so well, and it gets to a time you're not feeling it, you still want to. No, it's just because of how your senses are training itself. They are being used to that thing for a very long time, and so they kind of have a way of it. And it also applies to sight, as in the context of science, what we call relativity. When you move at a constant speed for a very long time, certain things may become a little bit constant for you. For example, if you move, according to science, if you are able to